Good evening. I am Ranjana Kushwaha, Policy Research Consultant for Institute for Governance, Policies and Politics. It is indeed a pleasure to welcome each one of you to this enlightening panel discussion titled Standards for Fairness Assessment of Artificial Intelligence Systems. This discussion is a crucial component of the broader Emerging Technologies and AI Governance and Policy Landscape initiative led by IGPP. Our mission within this initiative is to actively engage in the shaping of AI regulations with a commitment to fostering the development of robust, adaptable, and organic frameworks that ensure the efficacy and sustainability of artificial intelligence. Embracing a multifaceted approach, our initiative places emphasis on awareness, collaboration, and innovation, drawing insights from diverse stakeholders such as lawmakers, industry experts, researchers, and social scientists. Today's panel discussion represents a key facet of this initiative, delving into a pertinent issue at the heart of AI revolution, the trustworthiness of machines. As artificial intelligence permeates various sectors, a pressing question emerges. Can machine be trusted? This question becomes especially critical in sectors like health, where the reliability of AI systems in tasks such as diagnosis need careful consideration. Are AI systems safe, secure, and trustworthy? These are the questions that fuel today's conversation. Today, we have with us a distinguished panel to discuss this highly relevant topic. So we have with us Dr. Abhijnan Chakraborty, Assistant Professor, Department of Computer Science and Engineering, Associate Faculty, School of Artificial Intelligence, IIT Delhi. Welcome, sir. We also have with us Dr. Diptikalyan Saha, Senior Technical Staff Member, IBM India Research Labs. We also have with us Mr. Narayanan, Researcher and Consultant, AI Tech Ethics. The session will be moderated by Dr. Manish Tiwari, Director of IGPP and co-founder of Ranga, a digital parenting app. Now I hand over the session to Dr. Manish Tiwari for further proceedings.
Thank you so much, Ranjana, and thank you every one of you for coming over to this discussion, dedicating your time and to talk about the question which we are addressing today. I would just, we have all been wondering, can machines be trusted? And this is something which is not just we as an individual been thinking of, but nations and organizations and companies have been thinking of it. Whether can we trust machines? When we are talking about machines learning at their own and learn, all these LLM and all kind of things, then we sometimes start believing that, whether they would take over human beings. That is one part. Or whatever they are doing right now, can that also be trusted in terms of algorithms? Because somewhere like who is creating them, how they are being created, what are the standards, what is the fairness, all these questions have been coming to our mind. So in this uncharted territory where AI systems are becoming increasingly intertwined with our day-to-day lives, the risks associated with unintended biases even and errors in data cannot be overstated. Because you never know what is happening around it. Unintended biases or errors in data can have profound consequences for individuals relying on these systems, particularly in critical sectors like health, security, basic infrastructures. The need for regulation is particularly pronounced in this domain because it has been predominantly driven by the private tech sector. So we sometimes have a tendency to believe the governments for a better cause, but not the private companies or the businesses as such. So setting standards for AI safety becomes paramount as these standards form the bedrock of ethical development and deployment of AI. However, given the complex and sector-specific nature of standards, the risk is far from easy. Today, all of you, our esteemed panelists, we request you to share your insights on the importance of setting standards for AI systems, exploring the associated challenges, and discussing critical aspects such as trustworthiness, fairness, and biases. So I would like to begin with you, Dr. Abhijnan. do you feel like in deploying AI systems to critical sectors like healthcare, building trust is crucial? From your perspective, can we trust uh, AI systems in such sectors, and how can the trust be developed in these systems?
Yeah, thanks a lot, Dr. Tiwari. One important part of democracy is consultation, right? And this is great that we are also consulting, we are discussing, and we are hopefully will move towards a society like where wider consultation takes place, not only within the tech circle, but across other sectors or other parts of the society, right? Now, you mentioned about a very critical area of healthcare. Now, let me just tell you one like real story. I'll just not name the country or the company, but in some place, if you have really scarcity of hospital beds, doctors need to make a decision or take a decision that whether to keep someone for a longer hospitalization or for a longer stay in the hospital setting, or can someone be released to go home. Now, often the doctors take this decision keeping in mind the patient's condition and maybe many other factors like how many other patients are waiting to get a bed and so on. Now, of course, in developing countries, oftentimes in these cases, like people think about technology to be a solution which can assist the doctor to make a proper decision. So the doctor can simply rely on a tool. The tool can look at the health record of the patients and can inform that like what is the risk score associated with this patient. If you at a higher risk, then you can stay in the hospital for longer. If you get a lower risk, you can stay in home and just like undergo the same kind of treatment in the home. Now, as you can see, like there is a need for such systems, especially in hospitals where there is a huge demand. And likewise, like in some country, this kind of systems were widely deployed. In fact, many major players also started developing softwares which can do this. Now, one researcher started looking at the data, like who are the people who actually got a longer hospitalization and like higher risk score, and that is why like they were in the hospital for long, and they found an interesting pattern. They were finding that one particular group of people, if you just divide the population into different groups, one particular group of people were staying in hospital for longer, while with the similar kind of health parameters. So if you just go by the critical parameters, if you see the same parameters existing in another group, they were not getting the hospital stay. So then they started analyzing this further. And one interesting thing which which they concluded was that this software, whichever was being deployed, it was looking at data from the past, and hence any group who actually stayed in hospital for longer in the past, they were getting this decision that they should stay in the hospital for long. And oftentimes, since hospital stay cost money, if you are a poorer group or if you cannot afford a longer hospital stay, then the software will predict that you don't need that hospital stay, regardless of your actual vital parameters. Now, of course, when you ask a developer who developed this tool, they may not even know about this kind of biases which can exist in the data, because they are just building a model, and the idea is that you want to be as correct as possible. Now, only when you look at this at like different group level, or even when you try to look at this at different individual levels, where how the two different similar individuals are getting decisions, you will never know this kind of thing. And this is where I think some kind of a fairness standard, or I would call like a fairness testing, right? That come very useful, because then even the developer who is developing this, or maybe someone at that organization, can then test the system against some known biases and can see how they are scoring, and they can rectify. Now, of course, it might not be fully possible to make it fully bias free, and that need not be the goal, because we don't know what an absolute unbiased state is. But at least if we can know that there are some obvious biases and that can be rectified, I think we should go there, do that, and then it will bring back the trust in systems, as you correctly mentioned in the beginning.
Thank you, Dr. Abhijnan. I would like to come to you, Dr. Narayanan. What Dr. Abhijnan has mentioned about this particular case, and because for a machine, data is just a number at times. It sometimes cannot go for the kind of qualitative side of it. So when you are setting standards, what are the key components do you believe should be kept in mind to avoid such problems?
Yeah, thanks for bringing this up. I just wanted to start with a connected anecdote with what Abhijnan mentioned and then translate it forward. Because one of the main points that Abhijnan mentioned is that the developers may not always have perspective of the complications that could be there, that could be caused by the model, because their role is in a certain level. What we need to understand is, when we speak about trustworthiness, primarily we are speaking about how to enable stakeholders who are actually developing things to have a perspective of things that may not otherwise be of access to them easily. That's exactly what we're doing. So when we say trustworthiness, can I trust it, becomes a very surface level syllabical conversation. What we need to actually say is, if you need to trust, what is necessary? What is necessary is information sharing, belief sharing, and the sense of alignment in terms of what is required and why it is required, what are the complications or associated impacts caused by that. So that's the space that we need to look at. Now, let's look at the context that you asked about in this lens, which means that how can the developer be aware of what risks exist in different components of the AI system and different processes associated with AI activities? That's exactly where we need to segregate it. Either it is the process activities or the component activities. If we speak about component, we are actually speaking about how can the developer gain an understanding of the biases that are there in the data? How can they be aware of biases that are there in the model itself? How can they be aware of biases that could be there in the deployment environment? How can they be aware of biases that can get contributed because they have a human in the loop? Or how can they be aware of how the outcome can influence bias? These are all component views where they have visibility of how each of these components may contribute to bias. On the other side, when you actually look at it from a process view, every step that they take, how can their actions contribute to it? There's one of the examples, I think Dipti will expand on this, but I wanted to bring this up because this is something that we spent a lot of time on between me and Dipti when we were discussing about it, is that data imputation. So essentially, all data are not complete. You get data which is incomplete, right? And you want to try and develop a model out of it. Then what you typically do is you clean up the data, recognize where there are data gaps, and then you infill them. Now, this infilling process has multiple methodologies. There are people who apply average, there are people who apply median, there are people who apply different things to this, which means you're applying a variable, or you're adding content to a variable which did not earlier exist, and based on your own assumptions and parameters. So this is not coming from the original data. This is coming from what the activity that the user is, the developer is performing. So now that is where I'm saying even the activities that you do may directly contribute to it. So if we start looking at it from a perspective of the whole process of standardization is to help different stakeholders gain perspective on what can contribute to harm and how can that be prevented. And when we look at it in a manner of which are the components that can contribute to the harm, which are the process activities that can contribute to the harm, we are able to enable them to find better solutions than what we are even thinking or researching at this point in time. So that's the way I would look at it.
So I would, as you have also kind of, directed it towards Dr. Saha, I would also like to bring in one point here. As you are saying, I look at it in terms of in human psychology or the cognitive development of brain. When we see, or how does it develop? Even small incidences, what you talk, how you talk, what your family is talking about you, all those kind of things affect a cognitive development of a human brain. Now, similarly, what is that which impacts the data in terms of, as you are saying, that a lot of things are not coming from the data, but from the human component of the data. Now, in that particular space where it is a human intervention, how are we going to control it? So, from the industry's perspective, Dr. Saha, I would like to know from you, what are the limitations you see around there?
Sure. Yeah. So I think Sundar talked about the data bias, giving examples of the data which is bias which is there in the data, and the process which actually created that bias. Okay, right. So and in industry, when we come across different components, and when we try to judge a system and test a system for for fairness, we definitely look at data as one of the first key components, because that's the major source of bias, right? So, and then there are two components of the data. One is, the what kind of feature values that you have, and the what kind of labels do you have. So I'll take an example of label, right? So in many cases, these labels are actually not given by a single person. So maybe you take a string and you give it to 5 people, and they vote for in the range of 1 to 5, and then you put a threshold that what is your 0-1, the binary classification for that string? Is it good or bad based on the vote which is given to the 5 people? And you are controlling the threshold that what is suitable for you to make it good or bad, okay, right? And if you create your own threshold, this value of this binary classification from for probably from 5 votes are going to be different. Okay, so and we know that there are these labels are arriving from those kind of voting and putting proper thresholds or human created thresholds for that. Okay, and therefore when we see there's a data bias present, and which is very common actually. So we can even measure with some of the metrics that we have defined in our standard that whether there is any data bias or not. Example, there's one metric called disparate impact, okay, right? So demographic parity. We can measure whether data itself is biased or not, okay, right? And just by looking at the labels, okay, not even creating the model and looking at the model output. And that gives a flavor of whether if your data is quite a lot of bias, that is going to be reflected, as Dr. Abhijnan has pointed out. The data itself was biased, okay, right? And therefore, the system, the software itself predicted the same behavior which was there in the data. Okay? So therefore, we have to catch that what was the process involved in creating the data, identifying that process. And if there is a threshold, if we have the raw data, and there is a threshold that we are maintaining, okay, right? If we can change that threshold and make that data bias go away, that's probably a nicer way to just remove data bias from the process itself, okay, and then take it to a model and building the model from there. So just by taking the example, okay, right? So if there are raw data and there are human interventions there, and just changing the human intervention, we could actually arrive at much more cleaner data, much more unbiased data. Okay, so that's the example. And of course, there are other aspects to determination when we considered generating, creating the standard. Okay, right? So we considered various sources of bias. Sundar mentioned about the example of process and example of source of bias, which there is data bias, there is model bias, there are pipeline bias, infrastructure bias, okay, where we deploy, that's the bias, okay, human in the loop bias, okay, right? So various aspects of source of bias that we have mentioned there, and that and we've given a very good overview of those kind of where it originates. And if you can tap into those origination, those criteria, you can remove those bias at just by changing it and not by doing any post-processing to the model output or anything. Okay, right? So there's a process. By just changing the process, you can probably remove those bias.
So that brings us to kind of, I would say this kind of certifying those AI systems, certifying those pipelines and everything around of data, which is like, and particularly for critical sectors like defense and for health sector, these are very important. Dr. Abhijnan, how do you see, the limitations to these fairness metrics? What are the kind of things which actually stops it?
So one problem which actually we highlighted in the standard as well is that like, there is no one definition of fairness, and this is by design. This is not. I mean, we will not call it like a limitation, but this is the way the definitions actually originated from, because there is a underlying philosophical aspect to it. So it can happen that some particular system may be declared as fair along some axis, but along some other fairness axis, it can be termed unfair. Now, this is one issue which doesn't exist in many other certifications, where it is kind of clear that okay, this is the threshold we can pick, this is one performance metric, and based on that we can certify either it is fair or not fair. However, one thing which we actually also presented in the standard is that like you can take up many metrics, and we have listed several such metrics, and we can get the scores of them. And especially a sector like defense, someone who is procuring a software, for example, can actually look at the scores along these metrics and can then take a call. So rather than just saying fair versus unfair, you can actually have a score or have multiple scores, and then depending on the application, one can pick whether to select a software which is having a lower score along this axis and higher score along this axis, or I mean, it just provides a comparison point. So rather than just like a absolute certification, I would say this can provide a relative comparison between competing products.
Do you believe that, I can take this question to Dr. Narayan also, or anyone of you would like to answer that there is a need of a universal standard of fairness assessment of AI. When I'm saying, and how do we bring in cultural, social, regional differences? Now that is something, because it's such a thing which impacts everyday life in a longer run. At a larger scale, but also around the culture and social issues. How do you think those things can be brought in there?
I know you're speaking at a broad level, universal kind of a thing. At least I won't believe something like a broad level universal structure that is possible. But I still believe that there can be standards which speak the same language or similar kind of principles around it, right? Now, let's get to nuance of why we are actually discussing about it. So you deal with policy, right? So let's look at different states, right? Different states have population which are different, and in each of the states, people who are considered as underprivileged are very different, or people who are classified under scheduled caste, scheduled tribe, or identified tribes are very different. So a community which is classified as scheduled tribe in one state may not be a scheduled tribe in another state also. This is a complexity that we see. So if you apply something universal, even within the country, it will be fair for one and unfair for another, because the basic definitions are different here. So what I believe is we should never use one single kind of a measure or metric for standard per se, for measuring or looking at standard. But one of the things that we can definitely do is how do we enhance the principles, like what the proposition that is there in the standard itself is that you define your own baselines and then compare it against the baseline. Now, the baseline can be defined by industry, regulators, or the ministry itself, depending on what space that we are actually, policymakers themselves, right? And it is not a standard kind of metric everywhere. It is contextual to a particular problem, particular environment, particular kind of scenario. You may not apply the same thing everywhere. You cannot apply something same everywhere. A much more clearer example is that in the US, there is a concept called 4/5 principle. The Federal Trade Commission recommends it for multiple purposes when it comes to dealing with bias. Now, just 4/5 principle says if there is a category A of people and category B of people, right? The opportunity that is provided to category B of people cannot be less than 4/5 of the kind of opportunity the category A of people get. This is the kind of fundamental. Now, the complexity comes in when in this whole scope, if you are applying the same concept to healthcare. So you're saying somebody who's coming with the same disease, same kind of problems, you will treat one with 100% efforts and one with 80% efforts. It doesn't work. Right? So that's where I have a very strong opinion that it is necessary to have a clear baselining, context-specific baselining for applying it, but common principles that we're referring in the standard can be applied in many places and can be expanded to.
Can we?
Maybe,
yeah.
Maybe
please.
if I can add there. Okay, sorry.
Yeah.
So I think, as Sundar mentioned, this is very different. This is very different geographic specific, and it is not possible to make it universal. Okay, right? What is possible to do, perhaps, is to create a framework which is universal enough, where these different aspects of what is the threshold, what is the privileged class, what's the unprivileged class, what are the protected attributes, they can be taken as an input for different geographics and different scenarios, okay, right? So the framework becomes more or less uniform, that you have to test model bias, you have to take data bias, and you have to measure all of them for different modalities, different algorithms, you have to consider them. So they might be universal in a framework wise, whereas when you instantiate for your specific cases defined by your sector regulators, you can define your own thresholds and which is appropriate for your purpose, and measure the risk based on your definition, okay, right? Because based on the risk definition and risk, we kind of get what should be our thresholds, and so a framework can be universal, where the instantiation of the framework for various actual measures can be different, right? So that perhaps one thing that we can probably come to.
I think I was like coming to you with a similar question, and I would just extend upon what you have just said. So for such a thing, can we think of some international collaborations which can contribute to establishment of some kind of global standards? Which would also take into account the local, finesse about the whole thing. And what role do the diverse perspective they can play in shaping such standards? How do we see that if we talk about an international collaboration on such a thing?
Right. So I think I'll just reiterate there. Okay. Right. So if we are doing collaborations, okay, we have to respect each and every communities and the different aspects of the terms like protected attribute, privileged class, unprivileged class. The definition of them is different for different aspects and for different sectors. I think Sundar nicely gave an example of what we can do for, let's say, for detecting, for which works in healthcare, which might not work for banking system, okay, right? There it's not a life and death case, whereas in healthcare, it's a life and death of case, and you cannot be biased there, okay, right? So the threshold is different, okay, right? So we do have to respect various aspects of these different definitions that we have and different way people can consider. But then let's say the metrics that we have, okay, right? We do have for, let's say, supervised classification system already defined a set of metrics, okay, right? And over the last decade, the research has gone into for defining those metrics, and in which case it's applicable, in which case it's not. Those constraints are also defined, okay, right? So if we can get into a universal set of, the across communities and across geographies, okay, right, for different countries, okay, that we want to come close together, then we can define the frameworks, okay, right, where there is a lot of knobs to change the outcome, okay, right, whereas the framework that we have to, what we need to test, when do we need to test, and what is the risk factor associated with each of them, okay, right, that there are 3 risk classification that we have given our standard, okay, right, something which is dependent on life threatening versus something which doesn't affect our life decision, but it's all just principles and ethics, okay, right? So these kind of, the categorization can be universal, whereas you define your own appetite and you define your own measures and you define your own thresholds based on that, okay, right? So, so there's both possibility of taking something which is universal framework, whereas there are more customization possibility available for user to change it based on their own need. Okay.
So let's consider, like, we reach at such a thing, and we are also talking about fairness certifications. But given the economic and monetary aspect of it, and I bring to this question to you, Dr. Narayanan, like, particularly for startups and SMEs, those who are not really at such a scale, how would they kind of, take this challenge? Because this involves a lot of costs, and then that hampers the innovation. That is also one of the things. How do we deal with that? And I bring the question to you, but I would really be happy if any one of you also wants to talk.
Of course, I think Dipti and Abhijnan will definitely have a point of view on this. There's a question that we get asked about many times when we have conversations. But let's go to the bottom line. What is will you ask the same question to a doctor? Saying that, okay, why do you need to get certificate and all that? It costs a lot. Why do you need equipments? Just use a butcher knife and then do the surgery. You won't say that. Why are we saying that? Whether the doctor is poor or rich, you won't say that, right? So we need to be very conscious of asking the right question. We are putting it across saying that it's going to stifle innovation, right? If you harm population, then you can never find innovation. So we need to be thoughtful about it. Again, we are not stifling innovation. We are enabling better innovation by helping people gain perspective of challenges that they need to consider, which is not given to them as part of the problem statement. The problem statement is, like what Abhijnan said, is to predict who will require longer stay in the hospital, right? Longer treatment stays in the hospital. But the problems, there are underlying factors which are not said explicitly, but those factors can contribute to harms. Essentially, we need to look at it that way. Point number 1. Point number 2, I don't think it is expensive. It requires discipline, right? If you want to do everything at the end, it is very expensive, right? But if you can be mindful about it from the beginning, it's going to be incremental cost, which is not very significant. It changes the way we work. It is exactly like how people clean up their own houses. If you keep it clean all the time, it becomes much easier. If you clean it once in a week, once in a month, once in a year, then you end up spending a lot of effort and time and money, right? It's very proportional. And the third point is that it's a very big business advantage for startups at this point in time. The world is moving towards AI governance and trustworthy AI. The more the startups are able to demonstrate, it's going to actually gain them business advantage rather than stifle innovation or stifle business advantage. So it's counterintuitive to think that it will stifle innovation. It needs to be thought from this perspective that it is actually expanding innovation and possibilities by being able to serve organizations across the globe with trustworthy AI. That's how I'll put it across.
I'll just
Dr.
make
Saha,
maybe I'll just make one comment.
yeah, please.
I really like what Sundar mentioned, and one thing is that startups are often agile to change their direction, right? Which is often not possible for a really mature large organization. So I would say, as Sundar has correctly mentioned, that it is an opportunity. So I think we should also look at this as an opportunity, especially in markets like European markets, where now there is a lot of regulations which is coming in, like EU AI Act and other regulations. Even in US, there are certain regulations which are coming into picture. So if you are mindful of the fact that these are some regulations which you need to follow, and accordingly kind of adjust or accordingly change the development pipeline where there is a periodic check, right? So I think this can actually turn out to be an opportunity for us rather than the other way, just stifling innovation, right? So I completely agree with Sundar on this.
Yeah, and let me add also one comment, okay, right? So there's let's say a startup, okay, right? And there is a procuring organization who is actually taking the product which is built by the startup. Now, if the procuring organization itself tests for fairness and they reject their startup's product because it does not really adhere to the standards, okay, it becomes startup's responsibility, and it is affecting their margin of profit, okay, right? If they actually reiterate their development cycle once again. So it is definitely important that they do it once while in their development cycle, okay? And there are many open source tools now available for checking fairness, which will help them actually doing it freely, okay? It is not going to cost them. If they have to develop their tools all alone for their purpose, then it becomes quite a lot of expensive, okay, right? However, there are open source tools available, and they are very important just to use those tools, to know their usage, and make sure they use it in their development framework, and perform the in development process those fairness checks, just to make sure that tool, whatever the AI system that they're developing is fair.
One thing which Dr. Sundar just mentioned was about that the world is moving towards AI governance. And so we are also talking about AI governance as a country, particularly around the fairness and the certification and AI. Do you think, are we at a good place in terms of governance as a country? And I need comment from all of you.
I think we have just started, and actually this TEC initiative, by Department of Telecom, this is a good initiative. I know that there are several other organizations who are also contributing towards developing some kind of a fairness standard. Now again, this is a rapidly evolving field, so I don't think we'll just reach that stage at just one go. So it will require some kind of iterations, and we'll also have to see what the other countries are doing, especially it is, as Sundar mentioned, in multiple countries, AI governance is becoming a crucial thing. So I guess over time, we have done a very good start, but yeah, over time, it will just get a little bit more refined, and maybe after a few iterations, we'll get to a stage where things are a little bit more standard and comparable across other countries. But again, coming back to what Dipti mentioned earlier, it needs to be region specific, it needs to be country specific, culture specific. So we cannot just borrow a standard which is developed elsewhere. We have to have our own indigenous standard, which actually caters to the needs of the local population.
I'll share something. Are we in that position for AI governance at this point in time as India? Probably the answer may not be yes. I'm not saying no, because there is actions happening in many places. So no is not a fair statement, but yes is definite statement that we are still not there. But I want to actually look at it in a very different lens. We have 40 million people who are working in tech sector in India. Okay. So look at those. Sorry, it's 4 million people. Let's say 4 million people working in tech sector at this point in time. This 4 million people are there's only a portion of people who are working in the sectors of AI, right? That could be about 3 to 4 lakh people, right? What we are actually looking at is how these 3 to 4 lakh can expand into a 10 to 15 lakh population in the next 8 to 10 years. That basically means it is a significant workforce contributions to the world, not just for India. So then the statement that we need to ask ourselves is, do we want to be AI governance ready skill set of the world? Right? Automatically, by developing skill set which are AI governance ready for the world, we're going to put us ahead of the curve, and we're going to be the largest contributor of workforce in this space. So we just need to be looking at it from that lens, is how I see it. Dipti, over to you.
Yeah, and I just want to add one comment, is that the TEC is also considering robustness as the next standard, okay, after fairness. So I think we are slowly covering different pillars of trust, and once we actually have standards for all the pillars, okay, let's say robustness, fairness, and for different models, and make sure that there are implementations available which users can readily use it. And then I think we are at a stage we can probably say that, okay, we are building trustworthy system, and that's our core value. Okay, so yeah.
I think it's such a vast topic, and that way it's a little more technical, where, like, I would say my knowledge is definitely limited, and I'm enlightened by what I have known from this discussion. I think I would bring this discussion to end, because what we can conclude is this is an ongoing process. It would take its own time, and what is happening in India, what is happening world over, what industry is looking at, what developers are working around, it's something which is in transit. And as you have said, Dr. Sundar, that we are for the AI governance, like, you are saying that the answer is not yes in a way, but it's not no either. So it's a process, it will keep going, and we would be getting back to you sooner around it.